Overview of Clubfoot treatment. The Ponseti Method.
Clubfoot deformity is treatable. Undoubtedly, the deformity is a medical condition and not spiritual as many people think it is. Children born with the deformity who received early treatment live a normal life with no trace of the deformity.
There are quite a number of approaches clubfoot treatment can follow. Depending on the severity of the deformity, the use of brace, surgery and casting can all be an option to be adopted. Most at times, all clubfoot cases are idiopathic, and so the commonest treatment approach worldwide is the casting. The other approaches are becoming outdated due to the effectiveness of the casting method. The casting method is an approach called the Ponseti Method. The Ponseti method in clubfoot treatment is noted to be effective when a number of surgical interventions on clubfoot cases decreased from 70% in 1996 to 10% in 2006. This is quite a significant difference, showing that the use of simple solutions is highly effective, and that unnecessary operations can be avoided in this way. It is not only effective, but also fast, economical, and has long-lasting effect. The nature of the Ponseti method makes it more reliable treatment approach. The materials needed for treatment are locally available and comes with a cheap price, unlike the surgical and the bracing approaches. The Ponseti method has two phases: the corrective phase and the maintenance phase. Note that this video will not give a more practical form of the Ponseti method, but to provide some basic ideology to all the processes in terms of materials and the tools needed, as well as the best way to follow when it is adopted for clubfoot treatment.
The Ponseti method, as earlier mentioned, has two main phases: the corrective phase and the maintenance phase. The corrective phase is where the affected foot or feet will be stretched or manipulated and POP cast is applied. The manipulation is not a mere one, of course. The therapist follows some standard guidelines that seek to reverse the abnormal position of the affected limb to a normal position. Though both phases are important in the clubfoot treatment, the most complex and difficult part to consider most of the times is the corrective phase, because it needs some form of technical knowledge. The maintenance phase will be effective or successful only when the corrective phase was carried out properly. Remember that thorough education is important before the treatment even starts. Parents are educated well about the condition in order to clear all forms of misconceptions, and the need for the approach taken for the treatment must also be emphasized. Education on the weekly cast journey must also be provided, as it is an important part of the Ponseti method. Also, let them know about the maintenance phase, where a foot abductor brace will be recommended.
The Ponseti method is considered to be effective. Yes, it is, and there is no doubt. But always seeking early treatment is important. The casting must be commenced in a week or two, right after the baby is born and clubfoot is detected.
By using the Ponseti method for clubfoot treatment, therapist understands the need for assessment and will always considers it as a priority. The assessment of the clubfoot is successfully done by using a standard scoring system called the Pirani scoring system.
The casting follows an acronym CAVE. This can widely be expanded as C. Cavus, A. Adductus, V. Varus and E. Equinus. The cavus represents the extreme increased arc of the foot. This is due to the plantar flexion of the first metatarsal bone in relation to the calcaneus and the hindfoot. The adductus on the other hand talks about the excessive deviation of the foot toward the midline of the body, making the navicular bone dislocates from the talus. The varus also talks about the calcaneal bone being moved medially more extremely. This often corrects as soon as the adductus is corrected. The last one, which is the equinus, also talks about the foot looking similar as the foot of the horse, pointing down or in a plantarflexion in relation to the shin bone.
Clubfoot treatment with the Ponseti method requires some basic materials. POP. warm water, cotton rolls, a bowl, sharp scissors, a table with broad surface strong enough, a Macintosh, hand gloves, and a pen or pencil for recording certain details as may be required.
2 professionals familiar with the Ponseti method are needed for the casting. One of the parents with good rapport with the baby should be available in the unit to calm the baby, and to make him or her feel secured. Usually, the mother is preferable in that case.
After thorough assessment of the foot is done and respective values recorded, the casting is then commenced. One of the therapists grabs the affected foot gently and performs some manipulations. This is done with the left thumb placed on the head of the talus, as in the case of left foot. In right clubfoot, it is the opposite or other way round. It is important that the calcaneal bone remains untouched throughout the casting process. The therapist keeps the thumb on the head of the talus and then holds the forefoot gently with the other hand and begin to lift the first metatarsal bone. The knee is kept partially flexed and such position is maintained. The other therapist then wraps the cotton rolls around the limb nicely, covering the entire foot excluding the toes to the above knee. About 2 rolls will be enough depending on the thickness of the rolls being used. The POP is then dipped in a warm water once and it's also wrapped round the leg to cover up the cotton rolls laid down in the previous stage. Usually, about 2 POP will be enough to cover the entire cotton rolls. After covering the entire areas of the leg to the marked point, begin to shape the POP nicely by rubbing round the entire areas to make it look more nicer. This can be done by wetting your palms. The cast is then left in place for 1 week. Education on foot inspection is very important and the parents should be taught about it. Parents must do regular inspection of the foot for any allergic reaction of the foot with the POP. They should check the toes for unusual skin color change, offensive smell or swelling. These are red flags and if any of them is detected, a quick intervention must be done and the therapist should be consulted immediately. Too tight POP can cause swelling or discomfort and the baby will cry continuously or intermittently. In the next visit following the initial casting, reassessment is done. The next stage, which is the adductus stage, will be commenced only when the initial cast corrected the cavus. In our case, we assume the first cast corrected the cavus and so our second cast will be done to tackle the adductus. In this case, the foot is adducted and the cast is applied again. The thumb is always on the head of the talus during the adduction of the foot and the calcaneal bone remains untouched as well. Normally, depending on the severity of the clubfoot, about 2 casts will correct the adductus. Surprisingly, the correction of the adductus also corrects the varus, which should have been the 3rd stage. This is the main reason why the calcaneal bone must not be touched during the foot manipulations. The 4th stage will be to tackle the equinus. Following the correction of the adductus and the varus at the previous stages, the equinus becomes the next target. Here, the foot will be assessed to see if dorsiflexion of the ankles is possible. In most of the cases, ankle dorsiflexion of the affected foot is limited and in such cases, tenotomy must be performed to release the Achilles tendon. This is a simple operation whereby an orthopedic surgeon cuts the Achilles tendon.
Depending on the severity of clubfoot, the corrective phase can last about 4 to 8 weeks or more. Many factors can account for this variation. This means those factors will prolong the number of casts each stage requires, thereby increasing the timeline. It means that the period given as 4 to 8 weeks is not a one-time fit-all for all cases. In some cases, it may exceed even more. A good adherence to certain precautions and a good caring system by the parents or guardians contributes to the effectiveness of the casting, and recasting for same stage will be avoided in that regards.
So when the head of the talus is not visible again and the foot is fully abducted, and the tenotomy may have been performed when it is needed, the maintenance phase then commences. This is where the baby wears a special shoe called foot abductor brace, usually the Dennis Brown shoes. The shoes should have been worn for 24 hours, but due to bathing and grooming which will require the shoes to be removed, appropriate duration the shoes should be worn is 23 hours. This shoes will be worn by the baby till he or she is 4 to 5 years.
Wow! We have really learnt a lot. Isn't it? If I'm not scared, I can boldly say you can personally apply the Ponseti method. That is fantastic explanation. Undoubtedly, there are many cases of clubfoot which have been successfully treated with the Ponseti method and that its application is worldly acceptable. Always seek early care for a child with clubfoot deformity. Clubfoot deformity is treatable.
Please like, share, and subscribe.